Ladies and gentlemen, please welcome Ben Keel, Senior Director of Strategy and Innovation, and Chris Finley, Senior Director of Experience Design and Innovation, UnitedHealth Group.
Howdy. It's great to be here with you all. You guys got me fired up. I love it. And when the healthcare guy gets fired up, yeah, jacket comes off. All right. And, oh, there we go. UnitedHealth Group has the privilege of serving the youngest to the oldest amongst us. We have over 11,000 centenarians in our care. I'm pretty excited to be able to pronounce that word correctly, by the way. Took a couple runs. Our oldest member is somewhere around 113 years old. It's pretty cool. We have new members born into our care every couple of minutes. It's a privilege and a responsibility we don't take lightly. And in fact, UnitedHealthcare alone insures 1 in 5 Americans. Together as UnitedHealth Group, we touch 90 million people's lives. It's cool. And what's really cool about that is not that we're big. It's that we can help people when, where, and how they need it. We can make the health system work better for everybody and really deliver on their needs. Well, I can't deliver on this particular need yet, but and I think one of the most important things, certainly as someone working inside of this organization, is sharing the fact that we're not just a big company. We're actually a company full of people that are dedicated to helping people live healthier lives. We're groups of teams who want people to live better, happier, healthier lives. That's awesome. This is our mission statement, and it's half the reason I came to work for the business. But what keeps me going and keeps me engaged is not just the people we serve, but the people I get to spend my days with. The level of courage, care, commitment, and integrity demonstrated by my colleagues inspires me every single day as we go towards fulfilling this mission. People like Ben. The thing about people is, I knew there was a catch. We're really complicated, right? Well, I'll say it about myself. I'm weird, right? I do all sorts of weird things. You know, you catch yourself on a Saturday night, you got a cup of coffee and you're making a plate of spaghetti and you're kicking the, dishwasher shut. How would anyone know that, right? People are always seeing, thinking, feeling, hearing, doing things we can't even imagine. It's hard for us to sit in a room every day with somebody and really look at them and recognize that their life is as rich and as complex as our own. It's really powerful. And so we use a practice called human-centered design. I call myself a human-centered designer. We do this so we can reach into people's lives and their complexity and really spend time, driven through empathy and connection and care. We use those first to focus on deeply understanding people's articulated and, most importantly, unarticulated needs in order to design meaningful experiences. Simply put, we need to understand people's needs to design meaningful experiences. It's actually that simple. We go grocery shopping with them. We go to the doctor with them. We go where they are so we can really find out what's happening in their lives. Because there's a lot of things that I forget to tell people when they ask me questions. How many times did I shop last week? I don't know. Was my family in town? Was it a regular week? Right? When we just answer those questions, we don't always self-report accurately. So we have to spend time with people in their lives. And when we think about bringing that insight back into the business, we look at it through 3 lenses: desirability, viability, and feasibility. Now, it's easy for companies to think a lot about viability and feasibility, right? It's can we make money? How much money can we make? Can we make that? That's the easy part, right? And too often people start there. And they forget to find out, do people even want it, right? Why spend your time building the case for it if you haven't been able to go out and understand people's lives, be able to prototype and test that in a rapid way? So we're seeking to increase the confidence that what we're suggesting is the right thing to make and reduce the cost by making the right thing to start. And as we start thinking about the role that that plays in the world of healthcare, service to our customers, and as a business, we have to recognize that from 2010 to 2025, it's expected that $1 trillion, it's amazing, $1 trillion of value will move from old models of care to new patient-centered models of care. So never before has human-centered design been so important to the future of healthcare and to the future of the people that rely on it.
Thanks, Chris. So companies that are going to be successful in moving to this new sort of patient-centered model, by definition, better understand people. And at UnitedHealthcare, that's exactly what we've been doing. We've been very deliberate about doing that over the last several years, using human-centered design, as Chris mentioned. And what we've learned with spending time from people is that people do indeed have rich, complex lives. They've got a lot on their mind. They think a lot about money and kids and time. What we also learn is that they don't think about health insurance a lot. It's the reality of it. But we learned it, right? But what's more important than thinking about or understanding what people think about is understanding what's important to them. At the end of the day, what are their goals? And so what you see around this initial bubble is 7 high-level goals, things like being financially responsible, taking care of my family, being self-sufficient. This is what people are trying to accomplish in their lives. And I think while we can all appreciate the simplicity of these, I think these probably resonate with many of you today. They're hard, right? I can attest to the financial responsible one. I've got 3 teenage daughters. That's hard, really hard, right? But life happens. And for some people, cancer happens. And when we spent some time with people that were just diagnosed with cancer, we heard things like this. When you hear the word cancer, you go into shock. You're so in a fog, you're numb, you could have filled the room with smoke. Getting the initial diagnosis was traumatic, to say the least. And if you remember back to that previous picture, those goals that were there didn't go away. They just got a lot harder. And so for us as a company, that was our challenge. How can we help people still feel like they're accomplishing those goals, but at the same time while they're fighting for their life? So one of the ideas that we came up with was called Mahal Sherpa. Much like real-life Sherpas help people go up and down Mount Everest in Nepal, our health Sherpas help people that have really complex medical situations go up and down the mountain we call here in the United States the healthcare system, right? And when we first started to build this model, we started with very simple stories like this to get people's feedback on what matters to them, right? We learned what matters, but more importantly, we also understood what doesn't matter. Don't spend time developing that kind of thing for me. And from here, we brought it to life, right? So we actually hired 5 Sherpas to test it in real life. Let's try it out. And at the core of it is empathy. For some of our Sherpas, that was really easy because they themselves were cancer survivors or had family members that had survived cancer. And for those that hadn't, we brought in people that had survived cancer to tell them, what's it like to lose your hair? What's it like to go through chemotherapy and have chemo brain, right? I need to understand the people I'm serving if I'm going to serve them well. And by all measures of metrics and things of that nature, this program has been a success. You look at Net Promoter Score, if you're familiar with that, 95% was what this program was at. Customer satisfaction was off the charts. But what was more meaningful for us is when we started to get things like this. We had people start to call in just to thank us, to send us an email just to thank us, send a letter. I've worked in a lot of different companies, and I've worked in the call center space specifically for a lot of time. And it's not very often that people will just take time out of their day. This middle quote here specifically, I just had to call you to thank you well. You treat my wife well. Who does that, right? And so when you start to hear thank you, that means that you're onto something. You're doing something right. Now, the story doesn't end here. I'm pleased to announce that a lot of the things that we learned within the Sherpa program have now been scaled to a program called Advocate for Me. Advocate for Me helps about 16 million people navigate the healthcare system, and not just for cancer, but for other healthcare situations as well. It's a really successful program for us. So when we think about transforming the way that healthcare service is delivered, there's 3 things that we've learned that I think are important, and I think it goes across industries, right? The first is you need to understand people's needs. Healthcare specifically is really personal. I think we've forgotten that over the years, and so we need to make it personal again. Second, design for their journey, not yours as a company. And then finally, scales what matters most, and you'll know that you're scaling something that matters when you hear the word thank you. And with that, thank you for your time.